regular examination. Just an annual exam, just an annual wellness exam. No, we are not doing a cranial nerve exam today. Not today. We're just going to do a regular exam. You have very strange symptoms. The nurse told me about what's been going on. So, while I get prepped, why don't you just tell me about what's going on? I'm going to mask up because we want to protect ourselves, right? So, bear with me. COVID kind of changed everything, right? Okay, just sit back. This will be over before you know it. It's a very routine wellness exam. Just making sure everything is up to code. So, tell me about what you have been dealing with. What symptoms are you experiencing? Okay. Okay, and how long has that been going on for? Okay. Are you experiencing any numbness or tingling in your upper or lower extremities? Okay. Any weakness? Any nausea or vomiting? Any unwarranted weight changes? Have you lost any weight without trying to actively lose any weight? Okay. Any fevers? Okay. On a scale from 1 to 10, what would you rate your pain today? 10 being the worst. Okay. Okay. Now I'm going to begin my examination. Just relax. Is it okay if do I have permission? Okay. I was kind of already feeling your forehead before I asked, but I want to make sure before I continue. Am I producing any pain when I do that? Okay, I'm going to palpate down and let me know if you feel any pain or discomfort. And obviously, we will stop and re-examine. Okay, alright, okay. Next, what I'm going to do is I am going to test as soon as I find oh, really? No one's a fan of the doctor's office, to be honest with you. We do not take it personally. We understand that this is a very vulnerable time for you. This is a very vulnerable time for most people. people. So if they can avoid, experiencing that, we would prefer that as well. Okay, I'm going to get my scalpel here and just kind of tease the wound on your arm here. It doesn't look infected, but we want to be sure. There seems to be some kind of fibrous or kind of mucus layer over it, so we want to see what's underneath to see and evaluate if there's any healthy tissue growing beneath. And then let me know if this is painful for you, okay? I have been practicing for 10 years. I know I don't look it. I get that all the time. Still doing okay? Perfect. Any history of diabetes? Good. I was inquiring because uncontrolled diabetes can lead to a propensity or a higher risk for wound complications. Yep, we're just debriding the wound currently. Debriding the wound and allowing space for healthy tissue to grow without competing with this damaged or potentially infected tissue. Okay, still doing okay. Still doing okay. Okay, good. It's looking good. It's looking good. We're continuing to debride. But we're starting to get down past into the dermis. And this is where it might start getting a little bit more sensitive. So just please let me know if it's unbearably uncomfortable, okay? Okay, that's looking good. Okay, we'll stop there. I think we've got enough of the tissue debrided here, of the wound debrided. Have you been feeling dehydrated? Okay, that's good. Stay hydrated, that's very important. Okay, so I'm going to write you a prescription for strict bed rest. No, that does not say sketchbook. I still write paper prescriptions. So, we're a little bit old school that way. And no, my medical records are not electronic. I still do paper records. Yes, yes. No, I don't get cracked down on by insurance or like billing agencies because I'm that good. You see, believe in possible things, impossible things. Have a little bit more belief. Okay. So I'm gonna write you a prescription for an antibiotic. You're gonna take twice daily. The acronym for that is BID for 14 days. Okay? It is important that you do not miss a dose, okay, in order for the antibiotic to work at the most optimal. You need to make sure you take all of your doses, and at the same time every day. That can be in the morning, afternoon, or before you go to bed. Just make sure you remember to take your antibiotic at the same time, consistently, for 14 days, okay? And then we're gonna, what pharmacy do you prefer that to be sent to? We have a Walgreens and CVS on file for you. Walgreens, okay. On Campus Boulevard. Okay. Okay. Any allergies, any changes in medical conditions, allergies, surgical history, or medical history that I should be aware of within the last 6 months? Okay. You talked to your PCP about that? Perfect, okay. Are you on any blood thinners? Okay. 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 So, I'm going to give the script to my nurse, and she's going to run it down to the pharmacy for you. They'll make your prescription downstairs, and then once we complete your discharge paperwork, you can head downstairs to pick that up, okay? Do you have any other questions? Any other concerns for me for today? Yes, so this was just a preliminary examination just to ensure there was no underlying infection, which there does not seem to be. Hopefully the antibiotic will help improve your symptoms, but if not, I'm going to schedule you for a two-week follow-up to kind of check up on things and make sure we're doing okay. That by that time you should be done with your antibiotics. So